This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. Germany is the latest country in Europe to lay out how it will come out of lockdown. Some shops will reopen on Monday, with schools to follow at the start of May, but large gatherings are still banned until the end of August. Angela Merkel gave a detailed press conference explaining her decisions, but in the UK, the lockdown's being extended without any clear plan on how it will end. The Evening Standard's editorial column says it's time for that to be answered.
As the law requires, ministers are announcing that our lockdown will continue for another 3 weeks. That's essential and uncontroversial. But this is surely the last time an extension will be generally acceptable to people, without a much clearer explanation of how and why the decision has been made. The restrictions work, not just because they are being enforced by the law, but because the vast majority of us think they are needed, and almost all of us are doing our best to comply. It is an act of collective endeavour for the national good. This cannot be sustained by the random utterings of ministers or the anonymous thoughts of special advisers. Something so immensely serious must be supported by a serious process. So where is it?
Our political editor Joe Murphy joins me over the phone. And Joe, does the government have a secret exit strategy that it's hiding in Downing Street?
Well, the lockdown carries on. That was the one bit of news today that has been not a surprise at all. It's been well trailed. What was unexpected was the way people are now, in some quarters, demanding this exit strategy be revealed or worked on. And I think the big noise off today was Professor Neil Ferguson from Imperial College London, who gave an interview in which he was quite outspoken, saying he wasn't certain that there was an exit strategy, and he pressed for an acceleration of decisions. And the direction that he wants the government to go in is, as soon as numbers of cases are down to rock bottom, as near as they can get them, then to institute mass checking, mass contact tracing and mass tracking, so that any future outbreaks are dealt with in the way that the Germans have been quite successfully doing it, and the Koreans, finding them, isolating the people involved, isolating their contacts, so that you don't allow things to overwhelm the NHS again. But that is a subject the government is just refusing to discuss. The Health Secretary says we have a message, it's stay at home, save lives, protect the NHS, and any other discussion would get in the way of that.
There's no suggestion that the absence of Boris Johnson, the Prime Minister, is perhaps delaying things.
I think it has to be a factor, because we've had Cabinet meet today with Dominic Raab chairing it, and we've got Cobra meeting this afternoon with Dominic Raab chairing that as well. And Dominic Raab, the First Secretary of State and the Foreign Secretary, big figure though he is now, he is not the Prime Minister. And if you are going to signal a really big change of or development in policy, you do need the Prime Minister to be in the discussion and on board, because there is no point in him coming back from his sick leave and saying, actually, that's not what I want to do, or maybe simply, actually, yes, that's what we're doing, but the timing is wrong. Now, the Prime Minister is obviously watching the TV at his sick leave at Chequers, but we are told by Number 10 he's not working, so he's not taking part in these intense discussions in a full way.
One other issue has been around testing and the lack thereof of testing, but the government has stepped that up, haven't they, Joe?
They have, and there was a target of 25,000 tests by mid-April, and another target of 100,000 tests a day by the end of this month, which have both produced a lot of scepticism. Well, today, Number 10 is saying that they've now got a capacity of 35,000 tests a day, having harnessed commercial testing laboratories, which account to 15,000 of those, the other 20,000 being the NHS and Public Health England's labs. But there's a fly in this rather attractive sounding ointment, which is that yesterday only 15,994 tests were actually carried out. So that's a gap of, well, it's just half the capacity being used. And I think people will be asking, why is that? Because surely there are lots of people who want to be tested, people in care homes who have just been given access, and people in the NHS who want to know if they've got symptoms or not. And I think people will be wondering, is this bad organisation rather than a lack of demand? And the truth is probably somewhere in between. And it is crucial, because I could tell you that I've got the capacity to go out jogging, to lose weight, to tidy my spare room, and all the other things that I ought to be doing. But unless I actually get around to doing them, then that capacity is pretty wasted.
So we've got another 3 weeks in lockdown. At the end of this 3 weeks, are we expecting the government to say this is how we're going to get out?
My view is that the government will be under a lot of pressure to start the dance of the seven veils, revealing how they're going to do that sometime before then. I think that will be irresistible, and it will involve mass testing. They're getting the capacity to 100,000 for a reason. I think it will involve an antibody test. No country has yet got one that works well enough, but that is the direction that we're working in, and it's clearly what the government thinks is worth developing. And it'll probably, according to all the experts I talk to, involve either certain sectors of the economy going back, and certain groups like school children going back earlier than others, and maybe some regions returning to something more like normal faster than others. I say more like normal because actual normality won't happen until there's a vaccine, and that, well, a year or 18 months even away.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.